10 and 6 is 16, 17, 18, 19. Wait a minute. Okay, wait a minute. 2. Domino. I am Gwen McCane. I'm 73 years old, and I live in Oakland, California. I was diagnosed with pancreatic cancer in August of 2010. I conduct self-esteem workshops, and I'm always an upbeat person kind of thing. So when the doctor told me, I said, I'm doing a motivational speech in a couple of weeks. And he said, no, we got to put you in the hospital. I said, okay. And then I went to the specialist and they said, inoperable, incurable, there's nothing we can do. My face dropped, my husband's face dropped. We walked on out, we came on home. I received chemotherapy and radiation, and that went on for about a year. And then I was sharing it with my brother, and he said, oh no, I want you to go to Stanford. So when I went to Stanford, I met Dr. Chin, and she said, I know what's wrong with you. I know exactly what's wrong. And the biggest smile came on my face. It was a relief. And then I met Dr. Hwang. She was wonderful in explaining everything. She was very good.
When she came to me, she carried a diagnosis of pancreatic cancer and was told that she didn't have long to live, but they decided to give her chemotherapy, and then they treated her primary tumor with localized radiation, and that helped bat that back. She had 2 residual tumors in her liver, here and here. I knew that I could help her out. Microwave ablation is another way of killing tumors with thermal energy. The water molecules around the tip of the needle cause a lot of heat, and that causes the tumors to die where you put the tip of the needle. The great thing about image-guided ablations is you can kill tumors deep in the patient with no incision. Most patients go home the next morning, and I think that's a fantastic recovery.
When I woke up, she said, you're fine, I got it. And then when I went 3 months and my oncologist did the CAT scan, he said, we don't see anything. This is great. I feel good, and I'm just enjoying life. When doctors say it's inoperable, incurable, some people would just give up, and say, okay, that's it. I guess I'm getting ready to die. But, I have told all of my friends, you let Stanford have the last word on this one. They saved my life. Without Dr. Hwang and Dr. Chin at Stanford, I probably would not be here today.